Dental implants are really one of the most exciting things in dentistry to hit our field in quite some time. They're a simple replacement for your natural teeth. So when patients, if you're a patient, you happen to lose a tooth, in the past the only solution was either a removable prosthetic that came in and out, or a bridge that had to compromise two adjacent teeth and able to replace that one missing tooth. So it wasn't a real good solution. It worked, but long term it caused more damage than it did good. With dental implants, we're able just to replace that single missing tooth in 2 easy visits. So the first visit is maybe half an hour long, and we actually replace a screw, for lack of a better term, into the bone. We let that heal for about 3 months, and then we put a tooth on it in 3 months. And it's a fairly painless procedure. Again, it's about a half an hour. Most patients take maybe an ibuprofen later on. And that way, you have a single tooth replacement. You can floss it and treat it just like a tooth. Your patients don't know any different. All kinds of people get dental implants. You know, there's a lot of patients that come to see us that have had dentures that are missing all their teeth, and they don't have any way to keep those dentures in place because the denture's passive. It just sits there. There's nothing holding it down. So what we're able to do now is place implants in the bone and put little snaps on those implants that are incorporated into the denture base. So now patients can literally snap that denture in their mouth. And again, we do all that here. So we place the actual implants and we fabricate the prosthetic. So you're not having to go to a surgeon to place the implant, back to the general dentist for the prosthetic. Everything's done in one place. And I think, as a general dentist, and perhaps I'm biased, but if I'm placing your implants, I also know what the restorative needs are, so that there's not 2 people going between one person's solution. They're becoming much more affordable and much easier to place, and therefore much more accessible to anybody. We place them on a wide range of patients. Tooth today, depending on where it was and how you lost it, you could get a new tooth in about 3 months. That's what it would take total process to be able to get that new tooth in place. We have to place the implant, you have to heal for a little while, and then we can load it with a new tooth. But in the meantime, we could give you a replacement tooth that looks just like a tooth, so that you can walk out of here that day with a tooth that looks like you've got one in there temporary.